Good afternoon. It's Wendy Randall, consultant midwife from the John Radcliffe Hospital. And I am just joining you this afternoon to hopefully answer any questions that you may have. So today I'm based up in Whitney Community Hospital because I have some time with the Whitney Community Midwives this afternoon. So I wasn't sure if there was anything in particular that anybody would like to ask. And you know, the common things that we just want to reiterate to you are obviously still about staying safe and make sure that you're following the recommendations. Well, we're not anticipating any major changes in the next few weeks with regard to maternity, so we don't imagine there'll be any changes there. And it's just to remember to be vigilant, and if you do test positive for COVID, please do contact your community midwife and make sure that your midwife knows, because there may be some extra care that you require or some screening for the baby. So please, that is terribly important if you can let your community midwife know that. So the first message I see is from Ashley. So she says, I'm expecting DCDA twins and I'm booked to be induced on Friday. Your consultant said you could go home afterwards. However, when you get the call from the induction team to tell you the date they said you'd be staying, isn't it standard procedure to stay if you're expecting twins? So I'll go for the first bit before we answer the second bit. So in terms of women with twins, we do recommend that they stay in hospital. It's obviously only a recommendation, and if you would prefer to go home when you have your Foley's catheter in, that's absolutely fine. It's just that because it's a twin pregnancy, we've been keeping a closer eye on you during the pregnancy. But if your consultant has written in the notes that you can go home, equally that's fine. But please do what you feel is best for you. You know, we want to make decisions with you so that you are predominantly making the decisions about your care for the birth of your baby. You're saying also the next day, would waters be broken in the delivery suite as it's twins, or would this happen in the ward? And I wouldn't be transferred until you're 4 to 5 centimetres dilated. So again, we can break your waters on the ward, because obviously there's just as long as the baby's head is down and you know, engaged in the pelvis. But if there is any question over it, then they would take you to delivery suite to do it there. Just be aware that there can be some delays. So I think sometimes people think they have a time to come in for part of the induction, and like say 10 in the morning, and that's when you'd have your waters broken. But that's for us to start monitoring the baby, etc. And sometimes, depending on what's happening on the delivery suite, if it's quite busy, there can be a delay before we can continue with the induction of labour and break your waters. So do say, Ashley, it's worth bringing a book or something to occupy your attention with in case there's a bit of a delay there. So I hope that answers your questions. So Sadie, you said you just started expressing. I was wondering how much average breast milk I should give my baby at each feed. So Sadie, that it obviously is dependent on lots of things, depending on the size of your baby, what day you're at with your baby. If you're unsure, please do contact your community midwife. You know, there's some guidance, I think, in the on the postnatal care plan. There's a bit that tears off at the back, and that can give you some advice as well. There's infant feeding books, leaflets that you should have been given in your discharge packs. If you're unsure at all, then you can phone level 5 and speak to one of our team there. So please do, there's lots of support out there to be able to answer those questions, but it obviously depends on how well your baby is, if you had any problems or were on any drugs when you're pregnant, what size your baby is, etc. And how old your baby is. So it's better to have a bit more exact advice. So I'd recommend sort of having a look at the information around, and if you're not sure, then phone level 5 and they'll be able to help you. Amy, you're 37 weeks pregnant and you're booked for a caesarean as your baby's breech. How long can your partner stay with after birth with a caesarean section? So I'll go for the first bit first, Amy. So generally your partner stays, you're in the recovery area for about 2 hours after the birth of the baby, and your partner stays with you for that period of time. And it's when you transfer to the postnatal ward that your partner would then go home. So obviously if you were in the recovery bay for more than 2 hours, your partner may stay with you at that time, but it's generally about 2 hours. Amy, you've also asked how long do you and the baby stay in hospital if everything goes smoothly. So Amy, it depends on what time of day you have the caesarean section. If you're, for example, if you were to the baby by caesarean section this morning, we'd be aiming to get you home from hospital tomorrow evening, all being well. But if you had the baby this afternoon, you might not feel ready to go home tomorrow evening, and it might be Wednesday. So it very much depends on what time of day you have the caesarean section, how you recover, how quickly you get back on your feet, how quickly you pass urine after the catheter is removed, and that you and the baby feel well enough to go home, really. So we try to get people home as soon as possible because we appreciate that's where people would like to be, but obviously we want to make sure you and the baby are well enough to go home. So Emma, you've got my mum carried GBS with all 4 of her pregnancies and lost her first baby due to this. You had a private test for 36 weeks, which in your first pregnancy came back negative, and you're now 35 plus 3 with your second. Would it be worth having another test for this pregnancy, or is it likely that I'm not carrier? Emma, I suggest that GBS is something that when you have, it would be present there. It is something that you have and you can't get rid of. The infection flares and recedes. And so that's why your mum had it with all her pregnancy, because it is something that she will naturally carry in her body. You didn't have it in your first pregnancy. You've been screened already in terms of your urinalysis when you were first pregnant, and that was negative. And so, for us, it's unlikely that it is a problem, even if it is there. And we only advocate you having a test or offer a test if you've had it in a previous pregnancy. But obviously it's up to you, and if you choose to have a private test, then please do. But it's not something that we would recommend testing for. So Kelly, if someone was to test positive for COVID on arrival at the hospital, would they still be allowed to have a birth partner during labour? Yes, Kelly, we still encourage people to have a birth partner present during labour, and obviously after you have given birth to the baby, your birth partner would be encouraged to go home and isolate. The only time it would be different, Kelly, is if your partner was actually symptomatic. So if they have symptoms of COVID, we would ask them to go home, and perhaps you would want to replace with somebody else to be your birth partner. But to have two people, one of them, you might be symptomatic or asymptomatic of COVID, but having a birth partner there who is symptomatic of COVID it puts our staff at more risk. So we would ask that they go home and we replace them with somebody who isn't. But Kelly, anybody that if you were to ask a mum or a friend or somebody to come in and be with you if you tested positive, you need to be aware that they would have to be able to isolate when they went home. So I hope that answers that question. Kate, you said your caesarean section is booked for exactly 39 weeks because you had a previous caesarean, and now you're diagnosed with gestational diabetes. Would this be a reason to bring the caesarean section date forward? So, Kate, no, unless you were an insulin-dependent diabetic or somebody who requires insulin to treat your diabetes, then otherwise it would remain the same. So we're happy for pregnancies to go up to 40 plus 6 weeks for people who have gestational diabetes on diet. or who are on metformin, and then we would recommend either induction or caesarean section at that point. But obviously, again, that is a choice, but we try not to do caesarean sections before 39 weeks because obviously your baby has a risk factor for going to the neonatal unit with breathing problems after the birth related to the planned caesarean, and that would increase before 39 weeks, and we want to try and keep mum and baby together. So Dorothea, apologies if I haven't pronounced that properly. You're 32 weeks tomorrow. 1 week ago you started having period pain in your tummy, but it wasn't hard or a heavy pain, but something. Is it because your baby is growing or something else? So sometimes, Dorothea, I don't know if this is your first baby or not, but you get some Braxton Hicks, which can feel quite tight and uncomfortable, and can cause some cramping. You know, what we tend to say to people is take some paracetamol. It might be that you've done a lot, you might have stretched something and you just need to rest. So if you rest and you take some paracetamol and that pain goes away, then you can be reassured. But if that pain doesn't go away, we ask you to contact the maternity assessment unit, and they'll advise whether they need to see you or not. And if it's during the week, Monday to Friday, sort of between 8 and 4, and you're in Banbury Way, you can phone the maternity assessment centre and they may see you there. But there's always people around for advice. And obviously if that pain is still happening, then obviously it's worth chatting to your midwife or GP about. Charna, you said your biggest fear is testing positive for COVID when you went to labour and being transferred to the labour ward. Is it correct if this happens, I would have to labour and birth without my husband? So Charna, I think I've just answered that question earlier in this live session. But it really just depends on whether your partner is symptomatic or not. If they're asymptomatic, they can still be with you because we're not testing partners. But if they are symptomatic, we'd ask for them to go home to reduce our risk to staff. And like I said, you could substitute for somebody else. Becky, you're booked in for induction Friday. Have there been any changes to the birth partner restrictions given the COVID case numbers in hospitals have greatly reduced and the most vulnerable groups are now vaccinated? So Becky, unfortunately, no, there have not been any changes, and I'm not foreseeing any changes even after the Prime Minister's news tonight. So we're going to stay as we are. It's incredibly important for us not to be back in the position we were. We've been through a very difficult time over the last few months. We have seen a massive increase in people who have tested positive for COVID and have had some quite unwell women. And we are really keen not to go back to that situation that we've been through. We want well mum and well babies, and it's very, very important for us that we continue with what we're currently doing until we can be reassured that we're heading in the right direction. Becky, you've then asked, are my waters likely to be broken the next day on the delivery suite with my partner or on level 6 on my own? Becky, for the majority of women, your waters are broken when you are on level 6. After your waters are broken, you're welcome to go outside, have a walk about with your partner, and see if things will happen naturally, because we try to wait between 2 and 4 hours before we take you to delivery suite to see whether your body will naturally labour without needing the hormone drip. So that first bit, I'm afraid, is on your own, and then, like I said, you can go out, mobilise and get everything going from there. Emily, so you said, if I had a positive Group B strep result from a private test, would that mean I was still able to give birth in the Spires? So Emily, women that test positive for Group B strep, we recommend them having IV antibiotics in labour. And if you are happy to have your IV antibiotics in labour, yes, we can still give them on the Spires. If you decline your IV antibiotics in labour, then you can birth wherever you want to birth. but we can give IV antibiotics in the Spires for people with group B strep, and of course you can still use the birthing pool. Kerry, you said, do you recommend, are they doing the streptococcus swabs on admission, or is this something you do before? Is it symptomatic? So the group B strep swabs are something that women that are high risk are offered them around 36 weeks in pregnancy. And by high risk, we mean that they've had group B strep in a previous pregnancy or a baby affected with group B strep. If you haven't got any reason for us to think that it will be present, then we don't routinely swab for it, because when you look at the evidence behind it, you are giving a lot of antibiotics without any real benefit to mum and baby. But is this something you do before? I think I've answered that question. And is it symptomatic? So no, it isn't symptomatic, Kerry. It can present sometimes like thrush, but then you may also be having thrush. But we tend to pick it up in a urinalysis when you're pregnant. But it can be picked up for other reasons. But please don't be concerned about it. It's not something we routinely test for in this country. Alice, just a quick question really. Since about 18 weeks you've been having pain in your lower half between your hips. I'm not 24 weeks and still there, always an aching pain. Is there anything I can do to help this? As I've tried water bottle and everything possible for round ligament pain, it doesn't help. I always feel baby move in the middle lower stomach, like baby's pushing on my cervix. So Alice, what you might be experiencing is your pelvis is held at the front. It's not a solid bone. It's held by the front by a ligament. And when the ligament softens in pregnancy, there's some movement in that joint. So you might find so this can be called, it's referred to as pelvic girdle pain. What you might find is that it's worse when you lift one leg up from the other, or you open your legs apart. And if that's the case, then it probably is to do with the movement in the front of your pelvis. So we ask you to be careful if you sit down into bed. So sit on the bed, lean your elbow to the side and lift your legs together to get onto bed. And same when you're getting out of bed, try and keep your legs together to move in and out, whatever you're doing. If you sit into the car, put your bottom onto the seat in the car and then swing your legs together, because it's that movement that causes you to get the pain in your pelvis. There's a website, I presume that it's still the same, called the Pelvic Partnership, which can give you more information about that you might find helpful. Not many people will want to do any manipulation when you're pregnant, although there are some people out there. So you could ask a chiropractor or something if they would help. You can ask a community midwife for referral to physiotherapist, but be very mindful about, generally we have, it feels like we've got bricks in our handbag. If you're carrying heavy bags on your shoulder, anything that's putting your body out of alignment and putting pressure through one half of your body more than the other may cause a bit more discomfort in that region. You can take some regular paracetamol, that won't do the baby any harm, and may help you move a bit easier. But have a chat to your community midwife. But there are things that you can do to help keep you mobile. Okay. So Katie, have there been any changes regarding partners visiting after the birth? I'm very sorry, Katie. There's no changes, and there is not going to be any changes, certainly in the next at least 2 to 4 weeks. I think we have to be very, very careful what we do in maternity to keep you all safe. And thank you for your lovely positive comments. We are sorry that we're not telling you this is all changing and wow, it's all going back to normal. But we do have to be very careful. We have to keep you all safe. We have to keep your family safe, and we absolutely have to keep our staff safe too. So please continue to bear with us. It will get better. We're absolutely sure it will get better. But we do need to try and just keep going with the measures that we're doing because it's working. Corinne, thank you again for your positivity. You've asked, when do you recommend starting a birth plan, and is this something you work on with your midwife? So Corinne, could start doing your birth plan whenever. You know, it's good to start doing some reading round about it. I hope you've all managed to download the Mum and Baby app. So we very much invested in this in Oxford. We think it's a fabulous app to download, and it has a birth plan on it that, you know, can help you ask the right questions. Generally, because things can evolve during pregnancy, some people start a plan and then chat to their midwife about it when they start to see them more in the third trimester. And around 36 weeks, the community midwife will talk to you more to finalise, you know, what you've thought about the birth of your baby. And just remember, we absolutely recommend that the majority of women birth in a midwifery-led unit. So we're very lucky in Oxford that we've got 4 freestanding units. So you've got Wallingford, Wantage, Cotswold Maternity Unit and Banbury, which are all amazing. And a really good chance you might know your midwife who's looking after you when you're in labour. And then we've got the Spires, which is in the John Radcliffe Hospital, which is a few floors above the delivery suite, but an amazing place to go and give birth to your baby. And for higher risk women, I'm recommending that they birth on delivery suite, which again has bean bags, mats, balls. There is a birthing pool there as well. So, you know, have a think about place of birth as well. There's some films on this Facebook page that we've done over the pandemic, which will show our midwifery-led units. I think there's one that shows delivery suite as well, and absolutely the Spires. We've got on Oxford University Hospital's website in our maternity pages, we made a film on home birth and midwifery-led units. I'm very sorry, it's me again. Very sad that I promise there are much prettier consultant midwives than me, but it always seems to be, they get the grey-haired one out for these occasions. But yeah, there's lots of resources out there. So really start to see things, and certainly the stuff we've done over the pandemic on this Facebook page, lots of stuff on how to cope in labour, how to prepare yourself. Claire, one of the representatives, has made a how you pack, what you pack in your bag. You know, so really start to feel things out. There's lots of information out there. And we do everything we can to help to create as positive an experience for you as possible. But lots of information out there, and it's good. Plenty of time. We can't exactly go anywhere and do anything, but you know, have a real good look around. But don't watch any TV programmes like One Born Every Minute, please. You can watch Call the Midwife, I gather, but for me that's Busman's Holiday, so I've never seen it. Charlotte, oh, thank you for positivity again. You're just thinking about having another baby. So my fellow may have another baby with same partner. Right, got to understand this. Next year, you and your partner may have another baby. Would everything be the same with partners only allowed in when you go into labour? Charlotte, I absolutely hope not. I'm hoping that by the time we get to the summer, with everybody hopefully vaccinated and this virus under control, that we're going to go back to more normality. That's, you know, really important for all of us. But I suppose if the pandemic were to continue, or if we get something else similar, which, oh my goodness, please no, then obviously we have to keep you safe. So we will do whatever we think is safe. But you know, gosh, I really hope we're not still living like this in a year's time. Fingers crossed, everyone. Laura, you've asked if you get positive result, can you still use the water? Absolutely, for a positive Group B strep result. Yeah. Bridie, you're saying you're currently 36 weeks pregnant with baby number 4, and you've been induced in all 3 pregnancies for different reasons. Your last 2 inductions, you arrived at level 6 and were sent straight to delivery suite. If you require another induction, will you go straight to the delivery again? Yes, Bridie, because you are having your 4th baby, then we take you to delivery suite to break your waters. I suppose you might have your waters broken on level 6, but potentially it depends how well engaged the baby's head is, etc. Because sometimes when you're on baby number 4, baby's head can pop up and down. So if that's the case, then they want you on delivery suite. But it may be that they break your waters on level 6. So Laura, you've responded to Kelly by saying you had a COVID test on arrival when in labour, but wasn't an instant result and was told you get the result in 3 days. I think unless either you or your partner have tested positive before arrival showing symptoms, then you'll be able to have them there as normal. Thank you, Laura, for being reassuring. We have changed some of the way we do COVID testing now. So you have 2 tests. You have a lateral flow test, which is a swab that just does your nose, both sides, and you also have, so that one we can get a result within 30 minutes, and that just can help us to identify people that have a very positive result, and enable us to put in place a quicker plan of care. But we also do the one that takes about 24 hours, 18 to 24 hours to get the result, which is your throat and your nose. So you have 2 done now, which might be different, Laura, to when you had yours. Katie, if formula feeding, are the little ready-made bottles still available on your wards? Yes, they are. Yeah, to help get you started. So have you got a pregnancy pillow? Have you got pregnancy support? I found both help. Oh, thank you. That's you replying to Alice, who's having the pelvic pain. Thank you. It's really lovely that you're supporting each other too. So thank you so much for that. Yeah. Okay. So Laurie Betty, you said, just wanted to know, is having regular contractions every 2 minutes lasting 60 to 90 seconds considered the time to go into hospital? So Laurie Betty, if you're having your first baby, we say when the contractions are happening every 3 minutes, because every 2 is a wee bit close together, and you might find that it's a little bit more difficult transferring to hospital at that point. So if it's your first baby, when they're happening every 3 minutes, and because second labours and births are so much quicker, we say when they're every 5 minutes. The only time that's different is if the first time round when you had your baby, you had a planned caesarean section and you didn't have labour. When you go into labour the second time round, we say we treat you as if this is your first baby, so then it would be every 3 minutes. So thank you again for that support about bottle feeding. So Laura, you're saying, are there water bottles available at the midwifery-led unit? Are there water bottles? People tend to bring their water bottles in with them. We fill them for them. So some people will find that they get some plastic water bottles and put them in the freezer so that they're really cold, and they will obviously defrost as they go on. But if you bring in a water bottle, we can fill it. You're asking if you bring a lavender wheat bag, are there microwaves available to heat it for lower back pain? And yes, there are. But we also have, don't worry if you don't have a lavender wheat bag, we have these special gel packs that we fill them with water and we can microwave them. So there's not actually water, because water makes the gel swell and heat up. Yes, we have got an alternative to those. So Gemma, you're 28 weeks on Wednesday, being told my placenta sits at the front. You haven't felt real kicks or big movements. I feel uncomfortable at times, get sharp stretching pains when you move quickly, and bubbly feelings, which you imagine is baby, but should I be feeling more by now? So So Gemma, in terms of the baby, what you'll find is that baby will be a pattern. So you'll become more aware of your baby's movements. And as that happens, you'll start to feel more movements as the baby gets bigger, but you'll start to be aware of those bubbly movements and the stretching and things that you get as baby's moving about. And that becomes your regular pattern. And you'll start to feel more as baby moves from one side to the other. If you're not sure, please contact the maternity assessment unit for advice. Sometimes if you think, I'm not sure that baby's moving so much, if you go lie on your side, baby moves into a different position and you may find baby moving more. But there's always somebody at the end of the phone if you want to talk to them, so please do get in touch. Dora, you're almost 37 weeks pregnant. This is your first baby. Baby's head is engaged and you're having sort of sharp pelvic cervical pains in the evening. Is it normal? And yeah, I mean, baby's just, everything is in your pelvis. There's lots of nerve endings and baby can just press on different parts, and that's why it can be a bit more uncomfortable. Baby's getting ready to be born. So yes, I know it's terribly uncomfortable. It might help sitting on a birthing ball, or going on your hands and knees for a bit on the couch, just trying a different position to try and ease it if you're finding it uncomfortable. Tanya, a question about induction. Is it true that the cervix is already 2 to 3 centimetres dilated at the appointment? The catheter balloon is not needed and waters can be broken straight away. So Tanya, what we do is, because it's a 2-stage induction, we're trying to make it more gentler for people. So if you arrive in the induction suite and we examine you and your cervix is a good 3 centimetres dilated and we feel that it would be easy to break your waters, then we won't break your waters that day. What we would do is the induction team will give you a good stretch and sweep to stimulate some natural prostaglandins, and you'll go home to return the following day to have your waters broken, because the actual day that we're inducing you is the following day. The way we come in to do it the day before is to give you the run up to it, and to try and see if we can help you go into labour before. So, sometimes if your cervix is 2 to 3 centimetres dilated, but it's quite far back and it's still quite long, women benefit from having the balloon. Even if it only stays in for a few hours, it stimulates natural prostaglandins, but your waters won't be broken until the following day, because that's the day, the second day is the day we're expecting you to be in labour. So Jessica, you're saying if you go to the Spires but decide during labour that you want an epidural, will you be able to choose to go down to the delivery unit for that? Absolutely, Jessica. It's really important that you have, that this is your birth experience and you have the kind of birth that you want to have. One of the things we would recommend is, if you think that you're at that point, is we recommend that you have a vaginal examination just to make sure that your cervix isn't just about to become 10 centimetres, because quite often it's at that point that women are doing something that's called transitional stage. Women are just about to start pushing, and they either decide they want to go home or they want an epidural. So very much the midwife will talk to you, discuss doing a vaginal examination, because if you know that you're just about to start pushing, quite often women say, well, I don't want an epidural, I just want to get on with this. So that they'll help you with that decision, but they'll ultimately do what you want to do. And if you want to go downstairs for the epidural, then we will. Oh, thank you everyone for your positivity. That's really fab. It's really good that you can all support each other, because it is a difficult time for everyone. So I've got Laurie Betty. You said, when planning a birth on the Spires, low risk first baby, what happens when I arrive to the Spires? Is a vaginal examination necessary straight away? So no, we don't do an examination straight away. When you come in, we chat to you, we find out what your plans are for labour and birth, we find out what's been happening at home before you came in, how baby's moving, we have a feel of your tummy, check your blood pressure, etc. And actually, over that time, we're having a feel of your contractions and working out how often they're coming. And for some people, we may not think that there's the contractions might have spaced out since you arrived. Things have just slowed down again, so there'd be no point in doing an examination. For other people, it's very clear that they're in established labour, and we just need to help them with some pain relief, and we, or get the birthing pool ready, and we do that. And for other people, we may offer a vaginal examination as a way for you to decide what you want to do next. So very much you'll be pleased to know it's not a let's jump in there and examine you straight away the minute you come through the door. We want this to be as positive an experience for you as possible. And I'm just going to take a few more questions. So I'm going to answer Olivia and I'm going to answer Natasha, and then I'm terribly sorry, but I have to go for this week. And it may be, depending on what Boris says, that Louise, the chair, asks me to come back on later this week and answer any questions that you have. So I'm just going to do Olivia and Natasha just now. So Olivia, are the visiting rules being reviewed? No, and no, I don't think it's going to change in the next 2 to 4 weeks. So that's roughly what we're thinking just now. For the next 4 weeks, probably we're going to continue as we are. But I stay in very close contact with Louise, who chairs the Maternity Voices Partnership. And after Boris has spoken tonight, Louise and I will have a conversation, and we will post an update for you. Natasha, are you supposed to have a standard midwife appointment after 38 weeks? So Natasha, it depends whether it's your first baby or your second and subsequent baby. We've not quite been following the national guidelines in terms of appointments and pathways. We had to make changes during COVID. We're hoping to go back to a normal pathway soon, and that's in the planning. So the things that we are looking at is not perhaps changing the partner side of things, but making sure that we go back to a normal antenatal schedule. But Natasha, if you haven't got another appointment with your midwife, then please do get in touch with them and arrange it. So as I've said, I'm going to end here. I'm terribly sorry, it's short and sweet. Well, it's been 40 minutes rather than half an hour. Everybody stay safe. Please bear with us. We do want to get back to a sense of normality as soon as we can. So thanks again. Thank you for your positivity. Thank you for sharing everything. And we'll be in touch.